Okay, this is part 2 of the newborn nutrition lecture, and this is going to go over the actual process of breastfeeding. So how do we know when an infant is ready to eat? There's a key time where we want to initiate the feeding, and this is for breastfeeding and formula feeding. Okay, so we don't want to wait until the infant is crying and angry. They are not going to focus on feeding. Okay, they're too mad and upset. We don't want to try to feed a very sleepy baby because they're not going to be receptive. Okay, so how do we know when a baby is ready to start a feeding? They're going to show us. They're going to start putting their hands to their mouth, okay, as if they're looking for something to eat. They're going to do what's called rooting, whereas if you rub their cheek with your finger, they're going to turn and reach for it with their mouth, okay? And then they may start making mouthing actions, which just means they just start opening and closing their mouth as if they're looking for something to eat. How should a woman hold an infant? This is important, okay? There are different positions. Different women prefer different positions. It may depend on whether they had a cesarean section and their abdomen is sore, if it's nighttime or things like that. So these are the 4 common breastfeeding positions. So this one is called the football hold. The woman is basically holding her infant like a football underneath her arm and brings the baby up to the same breast on that side. Okay, you can see that she has a pillow underneath here to hold the baby in place. This is more comfortable for a woman who had a cesarean section because the baby's not laying across her abdomen or her incision. Okay. The other probably most common breastfeeding position is called the cradling position, where the woman is holding the baby in her arms. The head is supported in her elbow. She's holding the baby's butt, and then baby lays straight across her in a straight line and takes the breast. Modified cradle is the same as the cradling, except the baby's head is in her hand and the butt is in her elbow, and the baby's going across to the other breast. Okay? These are just preferences. And then lying down is when the woman is actually lying down on her side, the baby is lying down on their side, and brings the baby to the breast for breastfeeding. This one is also good for a woman who has a C-section because the baby is not laying on her incision at all. Okay. Now, you might think this is a good one for night feedings during the night. Yes, it is, as long as she does not fall asleep like this. Babies should not sleep in the bed. So if she's going to use this position or breastfeed in the bed during the night at all, the baby needs to go back to his or her bed or crib or cradle. Infants should not co-sleep. It's too easy. There are stories where the mom has rolled over and suffocated her infant. Okay. Now, a couple things to note for all of these babies. Proper breastfeeding technique is that the baby is lying in a straight line. Okay. Notice that the baby's legs aren't hanging lower. When the baby's legs hang lower, then the baby pulls on the nipple and can cause trauma to the tissue. Okay. It's important that the baby is supported with blankets or pillows to help keep the baby in a straight line. Okay. And up close. Bring the infant to the woman. Don't teach the woman to lean forward to the infant. That is going to be very uncomfortable for her back. So bring the baby to her. Baby in a straight line, feet not hanging. How does she get the baby on the breast? This is very important, okay? If this is not done correctly, the baby is not going to have a good latch, and there's going to be trauma to the nipple tissue. So as I said, bring the infant to the breast. You can see here she is holding the breast between her thumb and her finger, and she squeezes the breast a little so that the nipple protrudes. She can touch the infant's cheek or the lip of the infant, and the infant's going to open their mouth. When the infant opens the mouth wide, she just pushes the baby onto that breast, and all of the nipple and the areola should be in the infant's mouth. The infant should not just be suckling on the tip of the nipple. That is going to cause trauma. Breastfeeding, latching on, should not be painful, ever. She may feel a tingling sensation when the baby initially gets hold of the breast, but it should not be painful. If it is painful, she needs to remove the infant from the breast and start over. Now, removing the infant from the breast is very important also. We don't want to just pull the baby away from the breast because the baby's suckling on that and has created some suction. We don't want the infant to pop off the breast. So very easy way is the woman takes a finger, a lot of times the pinky works well, and sticks it into the corner of the infant's mouth to break that seal, and then can remove the infant from the breast. Okay. How often should a woman breastfeed her baby? Babies breastfeed more often than formula feeding. Breast milk is easier for the infant to digest, so it moves through their system quicker. So, a breastfed baby should eat every 2 to 3 hours. Okay? Every 3 hours at the minimum. Okay? So this is quite frequent. And as I mentioned before, the baby sets the schedule. We do not put breastfeeding babies on a schedule according to us. When that baby wakes up and gives us those readiness cues, that's when the baby eats. And it's going to be about every 2 to 3 hours. Okay? How long? Each feeding should be between 30 and 40 minutes in total. Now, some women will breastfeed on both breasts each feeding. So she could divide that time into 15 to 20 minutes on each breast. Some women like to breastfeed completely on one breast, this feeding, and then the next feeding will feed on the other breast solely. Okay? That becomes a personal preference. If a woman is breastfeeding on both breasts, each feeding, the next feeding should start on the breast that she left off on. Because sometimes the second breast does not get emptied fully. And so in order to keep the process going and avoid engorgement, the breasts need to be emptied. So if she's breastfeeding on both breasts each feeding, the next feeding should start on the breast that she finished on previously. Breastfeeding babies need to be woken up during the night to breastfeed. So it is every 2 to 3 hours around the clock. Breastfed babies will determine when they are ready to start sleeping longer at night. Infants should not be allowed to sleep all night and not be fed until it is determined that they have a good feeding pattern during the day and that they are gaining weight appropriately. Okay? And as I said before, breastfeeding should never be painful. That means that her technique is not adequate, and we need to assess that. So, how do we know if the baby is breastfeeding well? For the mom, her mature milk will come in at that day 3 or 4. It won't be painful. She will be experiencing those after pains because of the oxytocin causing the uterus to stay contracted. When it's time to breastfeed, when she's breastfeeding, the breasts are going to get full. And then when she breastfeeds, they will kind of empty and they will become soft. And then over time, when it's time for the next feeding, they will be full again. And then when she feeds, they will soften again. Okay? She will experience that tingling sensation I talked about with the milk ejection. So when the infant takes those first couple sucklings on the breast and that milk ejection releases the milk, she'll feel a tingling, okay? And then breastfeeding is very calming for a woman. And so she will feel relaxed and sleepy. How do we know by the infant if they're breastfeeding well? The baby's going to latch on without any troubles. We'll be able to hear and see the baby sucking and swallowing on the breast. The baby will sleep between feedings. And baby will have at least 3 bowel movements a day and 6 to 8 wet diapers a day. So, couple problems. These are the 2 most common problems with breastfeeding. And we talked about engorgement with a non-breastfeeding mom at about day 3 or 4 when the milk comes in, but she doesn't want to breastfeed. Well, then this can happen at any time during breastfeeding if the mom is not emptying the breast completely. So it's the same symptoms as we talked about before. The breasts are going to become firm. They might actually become hard, sore, tender, warm to touch, okay? So there's swelling going on in the milk ducts and the milk is not being emptied completely. So what are some interventions? She should start feeding at least every 2 hours to start getting those breasts emptied and back to that expected schedule. She can put cold compresses on them after a breastfeeding. If she puts cold compresses on them before, it's going to constrict the ducts and the milk might not release. So cold compresses after the feeding for the discomfort. She can put warm compresses on the breast right before feeding to help kind of soften and open up the milk ducts. Cabbage leaves we talked about. And anti-inflammatories. She should contact her doctor or the pediatrician to ask if there is a preference as to which medication she takes because she is breastfeeding. Okay, sore nipples can be very common, especially with first-time breastfeeding moms. And this is usually almost all the time related to incorrect technique. The baby's not in the correct position. The baby is not latching on and taking all of the nipple and areola, or the baby is not being removed from the breast properly, and it causes trauma to the skin of the nipples and can cause them to actually crack and bleed, and it becomes very painful. So if you have a woman, because this typically will happen after she goes home, if she calls and says, you know, my nipples are very sore, they're starting to crack, bleed, someone needs to see her and assess her breastfeeding technique. Applying breast milk. When she's done breastfeeding, she can squeeze the breast and expel a couple drops of breast milk and then rub that on the nipple. And then that doesn't have to be wiped off or removed before she breastfeeds next time because it's natural. It's a natural substance. She can purchase purified lanolin to put on the nipples in between feedings also. Okay. If they are getting to the point where they are really cracked and maybe they're becoming infected, the healthcare provider might order an antibiotic ointment. If she is using an antibiotic ointment, that needs to be wiped off of the nipple before each feeding. Breast shells. I will bring these to class. A breast shell is a kind of domed piece of soft plastic that the woman puts over her nipples in her bra, and it keeps the nipple from rubbing on the inside of the bra and helps with the healing process. Okay. Breastfeeding women may go back to work in 6 weeks. And so they may still want to breastfeed. So they can pump express milk and store it so that those who are babysitting, the baby will still get breast milk. It will be from a bottle, but it is still breast milk. So when a woman is pumping her breast, She needs to make sure that it is a clean process. It does not have to be a sterile process. So she needs to wash her hands. All of the bottles, all of the equipment that she is going to use to pump and store the breast milk needs to be clean. It can be washed in hot soapy water in the sink. They can actually be washed in the dishwasher. All milk that is stored needs to have a date, okay? Because it's only good for so long. When she first starts making storage containers of breast milk to freeze or put in the refrigerator, she should start with small amounts, okay? Because infants are not going to take a lot at the beginning. Their stomachs are very small. So maybe serving sizes of 2 to 4 ounces. And then as the baby gets larger, if the baby wants more, she can combine containers of milk. When it's time to thaw the breast milk, warm it up for a feeding. We don't give babies cold breast milk. It can be room temperature, but we don't give them cold right out of the fridge. So if she is thawing or warming up breast milk, we never microwave it. It can be put in a bowl of warm water, or it can be left in the refrigerator to thaw. Okay? We never refreeze. Once it thaws, the content, it changes, so we can't refreeze it. Okay? Any milk that has been unused and has been left in a bottle cannot be used after 1 to 2 hours. Once the infant sucks from the bottle and takes some of the milk, their saliva will mix in. It might start to break down after a couple hours. Also, it's been sitting out for too long. If a woman is storing breast milk in the freezer or in the fridge, it should not be stored in the door shelves, because when the door is opened and closed, there's more change in temperature. Okay? So it needs to be stored in the refrigerator or freezer and towards the back. How long can breast milk be stored? Once it is pumped and put in a bottle, it can be left at room temperature for 4 hours. That's the longest. Okay? It can be kept in the refrigerator for 4 days. It can be kept in the freezer, depending on the kind of freezer. If it's an upright freezer or it's like the top or bottom of a refrigerator, up to 6 months. If it is a chest freezer, like a deep freezer, it can be kept in the freezer for up to 12 months and used. And so these are just different manual pumps that a woman can use to pump milk. This is a electric one. There are battery operated ones that have a suction and release process that causes the breast to release the milk. Okay, and that is it for this one.